As Andrea just shared, the purpose of this report is to present an overview of meaningful indicators of Georgia's women's equality and well-being in health, education, income and employment, and political influence for 1970 pre-Roe and today. Before we provide a summary of our report, we must acknowledge the COVID public health crisis affecting our nation. Despite early reports as a shared social experience, COVID-19 has revealed and exacerbated the systemic racism that fundamentally structures our country. The historic legacy of systemic racism has produced unequal healthcare and working conditions that put Black and Brown people at a much greater risk of contracting and dying of COVID-19. Our current climate makes clear that we cannot have a full conversation about reproductive health and justice without acknowledging the inequalities caused by systemic racism.
We're going to share highlights since we understand there is only so much content we can handle on Zoom. We eager for folks to read the report and send us comments, questions, etc. in the coming weeks or months. Aspirations to reproductive justice began with 1973 Roe v. Wade decision and was further codified by the 1992 Casey decision. These decisions have given women the constitutional right to have an abortion, as well as privacy, autonomy, and liberty. Implicit in both decisions is that women's rights to choose when if to have a family is consistent with the constitutional liberty doctrine established by the 14th Amendment. Reproductive justice refers to access to family planning, safe abortion and contraception, pre-postnatal care, work with flexibility, maternal family leave, and affordable child care for all women. We share this aspiration for true reproductive justice, particularly because it will address the public health crisis of systemic racism.
We'd like to underscore that the overall results of our research suggest that Georgia's current draconian abortion ban law is a symptom of a much larger problem. Lawmakers have failed Georgia's women by nearly every measure of women's equality and well-being for the past 5 decades. But let's begin with some positive indicators. Georgia's GDP has been growing steadily since 1970 and now represents the 9th largest in the country. Women have played a vital role in this growth. In fact, today more women in the state complete bachelor's degrees or higher than Georgia's men. Today, about 41% of businesses are owned by women, ranking Georgia second in the nation. And Black women now have the highest labor force participation rate at 63.6%, with over 1/3 of Georgia's Black women owning their own business. For the first time ever, 3 of the nation's top medical associations are led by female physicians from Georgia. Dr. Patrice Harris, president of the American Medical Association, is the first Black woman to hold that position. In 1977, only 4.7% of our state legislature were women. By 2019, 30.5% were women, more than any other state in the South.
It is important to note that this progress was bolstered by the pioneering efforts of girls and women during the 1950s through the early 1970s. For example, Black girls and young women were the pioneers of school and higher education desegregation. In 1968, Atlanta domestic worker Dorothy Bolden co-founded the National Domestic Workers Union of America, ultimately leading to better pay for the sector, but also bringing visibility to an often invisible female labor force. Because of a now lawsuit and new federal laws, women in medical schools increased dramatically between 1970 through 1975, and in 1975, Morehouse School of Medicine was founded.
That same year, 1970, Georgia passed a law for access to safe hospital abortions. While the passage of the law saw an 80% decrease in white abortion mortality, Black abortion mortality only decreased by 33%, leading medical professionals at the time to call this Black abortion mortality issue a Black health problem. At the time, Georgia had the highest U.S. maternal mortality rate at 177 per 10,000 births.
Today, Georgia continues to lag well behind other states when it comes to women's reproductive health. Georgia continues to have one of the highest U.S. maternal mortality rates at 40 per 100,000, or 62.1 for Black women. And of the 159 counties in the state, 70 are now without OBGYN care. The health insurance coverage rate for women in Georgia ranks at a dismal 48th in the nation. In addition, while 11 states now have family and school leave provisions, Georgia has none beyond the unpaid Federal Family Medical Leave Act.
This is also the case when it comes to equality in the workforce. The pay gap between working men and women in Georgia persists, and it's even worse for women of color. Just to put this in perspective, if an employed woman in Georgia were paid the same as men, their poverty rate would be reduced by nearly half. And poverty among employed single mothers would drop by nearly 2/5. In education, we see inequalities as well. Black and Latinx women are less likely to receive an associate's or higher degree than white women, particularly outside the metro Atlanta area. Additionally, despite Georgia's GDP being ninth largest in the country, funding for K through 12 in the state is a major concern. Georgia has cut approximately $9 billion from public schools since 2003. Since 1970, families have become more diverse and smaller. Today, 34% of families with children are headed by single parents, more than doubling since 1970, the majority of whom are women. Despite these changes in family structures, state policies continue to view families as husband and wife with 2.5 children. An example of this is the dramatic cuts to temporary assistance for needy families, TANF. Since 2009, the Georgia General Assembly has cut available TANF funds by almost 30%. While the status of women in Georgia has certainly advanced since 1970, Georgia pales in comparison to many states and other regions in the country. Some of this lag has to be attributed to the South's history of regressive and segregationist policies. Yet a paradox emerges between opportunity and these disparities. Women, and particularly Black women, are driving business ownership in the state. The educational attainment of women exceeds that of its male counterparts. Workforce participation has risen, yet equality remains a distant goal. Women in Georgia are far from the promise of full equality or even reaping the benefits of increased participation in the workforce, political participation, and educational attainment. The following are initial recommendations, many gathered from our partners here today, to improve the status of women in Georgia. Number one, the Georgia legislature should ratify the Equal Rights Amendment Act, ERA, to the U.S. Constitution. The ERA will provide, for the first time, explicit constitutional recognition of the fundamental notion of gender equality. Number two, repeal Georgia's HB 481 and other restrictions on access to abortion care. The reproductive rights of Georgia's women should be affirmed by the legislature and not rely on the courts for protection. Number three, fully implement the Affordable Care Act with full funding for Medicaid expansion. Women are the majority of those on Medicaid. Family planning services, maternal health, post and prenatal care would be available to hundreds of thousands of more women in Georgia. Mandated paid family medical leave. That's number four. Paid leave allows workers to take time off to address serious health and caregiving concerns without risking their lives or livelihoods. 5. Produce an annual report on the status of women in Georgia. A comprehensive report would shine light on the status of women in Georgia and provide a common frame of reference for evidence-based policymaking to improve women's equality in Georgia.
We hope our report provides a critical perspective on the status of women in the state of Georgia and can contribute to the policy discussions that will have a positive ramification on the lives of women throughout the state.
Thank you all for listening to us, and especially thank you to Georgia's ACLU for providing us with such a rewarding and unique opportunity.
We're looking forward to learning more from our panelists who are on the front lines of fighting for women of Georgia.